Morning, everybody. Welcome to this week's Mancoll Minute. So, lots of topics to discuss, but I thought I'd kind of touch on a very specific topic about a post-op suggestion I have / requirement I have for folks, and that's to wear compression garments. And obviously it depends on the operation, but let's talk about body contouring, which I do a lot of, whether it be liposuction, tummy tucks, Brazilian butt lifts, brachioplasty, meaning arm lifts, thigh lifts, so on. Compression garments, in my opinion, are an important part of being comfortable and kind of giving your body the support it needs right after surgery at a time period where swelling is a very big component. And when I talk about swelling, I'm not talking about fluid that I've used in the tumescent fluid. I'm talking about how your body responds to the trauma of surgery. All operations will have swelling after it. How much swelling could vary from patient to patient, the degree of trauma, factors like that. It may have something to do with your diet, sodium content, carbohydrate content, things of that nature. But compression garments are designed to kind of control that. Earlier in the week, I had a patient with liposuction who was really worried because her garment wasn't as tight as she thought it should have been, and was really almost frantic about it. And I tried to assure her that's not going to change her outcome from good to bad. But what I tried to have her conceptualize was, with liposuction, think of a block of Swiss cheese with a bunch of holes in it from your skin to your muscle layer. And we're trying to compress that down so those holes don't stay filled with fluid, but they kind of stick together. And so your tissues will have a little less laxity to them. That space, those seroma potentials or fluid collection potentials won't be there. And a compression garment is going to do that. Also, I'll tell you, patients will tell me over and over again, gosh, when I take my garment off, when I go to shower, and within 20-30 minutes I start feeling myself swelling, I'm more uncomfortable, I can't wait to get my garment back on. So it's for your comfort. So for me, I want a garment that's going to cover the areas that we operated on, top of back, middle, lower, front, sides, legs, arms, whatever it is. It should be compressive, it should be snug, but it shouldn't be so tight that it actually is constricting, which I've had happen, and I've had people even get skin breakdown because it's too tight. So what we'll do is I'll tell a patient, try your garment on, and this is obviously pre-surgery, make sure it fits and it's not got that too compressive feel. After surgery, theoretically, yeah, you're gonna be smaller, but you're gonna swell. And I told this patient who was worried it was too loose, we're gonna put some foam in there. Foam's just a way to kind of give extra padding. It's like a gasket. It sort of helps even out areas in our body that are not perfectly straight, particularly the lower back or the sides or on the hips, those kind of areas. I also like it because it helps to smooth out skin, so when you put that garment on and it comes around, you can get wrinkling in the middle, and we don't want wrinkling because that could stay there. So we want that to be smooth. So compression for me is very important to maintain all of those, but it is not the so critical a step that if it isn't exactly perfect, that it's going to be the difference between a good or bad outcome. And the truth is, I don't know what the right compression is. There's no study to compare 10 millimeters of mercury to 15 to 20 to say that's the perfect compression. So it's a concept of compression to think about. And these are the theories of why I want people in it. Now the backside of this is, I only want you in compression about 6 weeks. And the reason is when you use it, particularly in your core, guess what? Your core muscles don't work as hard. They don't have to. You've got that support. So at least in my brain, it makes sense to get rid of it at 6 weeks for the reasons I just mentioned, those holes in the Swiss cheese closing down. The swelling is kind of on the back end almost, it's certainly not getting worse for people. At this point, I want you to fully engage your core muscles and not have a crutch, so to speak, with a compression garment. So that's my philosophy why I sort of have it go and stop at 6 weeks. Now I have a lot of patients come in because they saw on the internet or saw a YouTube video where they said, no, you've got to wear, and you got to go to a trainer, and you got to go to step 2, 3, 4, 5 compression garments for 6 months. And my answer is, show me the data. Show me the science that says this gives you a better outcome. I'm happy to change my opinion on it. But in the absence of it, I'm not going to go with a random YouTube video's person's opinion, even if it's another plastic surgeon, because they can't show me that it made a difference, but I can show you core strength weakening after 6 weeks. So that's my philosophy. That's sort of what I try and impart on folks. These are principles, they're never absolutes. they're the concepts of how I take care of folks. So hopefully that clarified it to some degree. If you have any questions, you're welcome to give my office a call. Certainly if you're a patient of mine and this isn't what you remember me saying, please give me a call so I can clarify it for you. Otherwise, have a great weekend, have a great summertime, and I'll talk to you next week.